Greetings, I'm Dr. Asha Mahilmaran, sending greetings on the eve of Women's Day, which falls on March 8, 2023. The health tip which I would like to share with you all is about cardiovascular disease in women, and especially the post-menopausal women. Women often think that they are at risk from cancer deaths like cervical cancer or breast cancer. But the truth is, they are at much higher risk because of cardiovascular disease than any other disease. Cardiovascular disease is the leading cause of mortality, that is death in women. It contributes to 16.9% of death in women. And especially postmenopausal women are at higher risk. As the age advances, the women become higher risk for cardiovascular disease, so much so that after the age of 60, women outnumber the men in terms of heart disease. Why is it so? Estrogen, the hormone which occurs in the premenopausal women, is generally protective to heart. It produces arteriolar dilatation and it reduces the cholesterol levels and prevents women from having blood pressure, cholesterol, and diabetes. As soon as this estrogen starts declining in the perimenopausal period, that is when a woman reaches her mid-40s or 50s, the estrogen levels start declining. And at this time, the LDL, the bad cholesterol, starts to increase in women. And also, the women tend to develop blood pressure. Blood pressure and high cholesterol levels and also obesity are very powerful risk factors for cardiovascular disease. And the Indian women generally do not have enough physical activity. So all this leads to cardiovascular disease increase in the postmenopausal period. And if a woman has a diabetes or a family history of heart disease, this estrogen decline can occur even in the premenopausal state, or they can become less responsive to the estrogen. So all these contributes to early premenopausal stage, also cardiovascular disease in women with diabetes or premature menopause. What can we do as women to prevent cardiovascular disease? Is it a fact that all women should face cardiovascular disease once they reach postmenopausal state? No, not necessarily. If we do the right things, we can prevent cardiovascular disease. So what are the tips to right health and appropriate health measures? We need to walk at least 150 minutes a week. That is 30 minutes of exercise at least 5 days a week is recommended. Eat healthy, avoid junk food, avoid too much of sweets, take cereal foods 3 times a day with plenty of vegetables, water, and you take 1 or 2 fruits a day, healthy protein, lean meat, or egg white, or healthy pulses should be included in the diet. Sleep regularly, at least 6 to 7 hours of sleep is recommended. Any sleep which is less than 5 hours has been shown to increase the heart attack incidence. So sleep on time and have a good quality of sleep, all of which will prevent heart disease. And regular physical exercise, maintaining your body mass index, that is the weight appropriate to your height, should be maintained. In addition to this, you should know your numbers. How much is your blood pressure? How much is your sugar? How much is your cholesterol levels? And periodically monitor them. And if they are high and out of range, take appropriate corrective dietary measures and also follow the advice of your doctor to take the right drugs for these conditions, and which will help you prevent heart disease. Thank you all and wish you all a very happy Women's Day and a healthy future. Thank you.